I'm Keri. I'll be your nurse today.
Hi.
Can you tell me why you're here today?
I just fell the other day playing a sport, and I'm just like really sore and like stiff all over.
Everywhere?
Mhm.
Okay. And when did this start?
I fell last week, so like the next day, so like 6 days ago.
Okay. And it's every day.
Yes.
And is there anything that provokes this pain, makes it worse?
Whenever I like run or like move like real fast or anything.
Okay. And can you tell me a little bit about the quality of the pain? Like, is it like sharp or stabbing pain or
just achy?
Achy?
Mm-hmm.
Dull?
Mm-hmm.
Okay. Does the pain radiate to anywhere else? Or it's everywhere?
It's like everywhere.
Certain spots more than others?
No.
No? All the same?
Mm-hmm.
Can you rate your pain on a scale of 1 to 10?
It's like a 5.
A 5, so not too bad.
Not too bad, yeah.
Just enough to be annoying.
Yes.
And does it come and go, or it's all constant?
It's like pretty constant.
Constant. Okay. Well, we'll get this figured out for you.
Okay.
I'm going to test your temporomandibular joint to make sure that everything is intact there. So I'm going to test the size and just make sure that it's symmetrical on both sides of your face. And it looks symmetrical. And the size looks normal to what it would be. It doesn't look like there's any swelling. Doesn't look like there's any bumps or lumps in terms of contour. So that looks good. I'm going to ask you to test the range of motion for your jaw. Can you open and close your mouth for me? And then move it from side to side. Okay, good. The color looks normal. It doesn't look like there's any swelling. And does anywhere on your jaw hurt? No, okay. And it doesn't look like there's any masses or bumps there. But now I'm going to palpate, and I'm going to just feel your muscles. So can I have you open and close so I can feel your jaw? There shouldn't be any clicking or noises. Do you feel any clicking there?
No.
No? Okay. And I'm going to have you grind your teeth for me so I can feel the muscle. I'm going to have you push on my hand to test the strength of your jaw, and push on this one. Good. And it doesn't feel really that warm. It feels pretty normal in terms of temperature, so that's good. Right, now I'm going to test your spine, your cervical spine, which is the neck area. And I'm going to look at it for symmetry right now and make sure that both sides are the same and it sits on your shoulders equally, bilaterally. And it looks like a good size to me. There's no visible swelling and the contour looks pretty good. It's no lumps, bumps, or anything like that. I'm going to test your range of motion by having you put your chin to your chest and tilt all the way back as far as you can go. Good. And turn side to side for me. Okay, perfect. Okay, I'm just going to take a look at the skin and make sure the tissue over the joints are good. Color, no swelling. It's normal skin color, no redness. And it doesn't look like there's any masses or deformities. So now I'm just going to palpate and make sure that temperature is good, doesn't feel real warm, it's normal. And does this muscle in here hurt at all?
Not really, it's like a little sore.
Okay. Stiff a little bit?
Yeah.
Feels a little bit tight. And I'm going to test your strength by just having you push on my hand as far as you can go. Good. And other side. Good. Now I'm going to test your shoulders for symmetry. And that looks good, they're equal. Doesn't look like there's any issues there. They look the same size, and the contour is good. There's no bumps or lumps or anything like that. Good. And I'm going to test your range of motion by having you put your hands up above your head, like that, and then put them all the way behind you as far as you can go. Good. Now I'm going to have you do an internal test. So I'm going to have you fold your hands in back there. Does that hurt at all?
No.
Okay. And now I'm going to do external and have you put your hands up behind your head. Good. Perfect. And then I'm going to have you do your rotator cuffs.
Mm-hmm.
You can turn around.
Okay.
Circle. Yes. Test your rotator cuff. And then I'm going to have you turn around one more time. and I'm going to have you test your hands behind your back like this. Like,
Grab your hands.
on both sides as much as you can go. Good, that looks good. And the other side. Okay, the other side's better. It's like that's a little stiff there.
Yeah.
Okay, alright, good. Now I'm just gonna test for, I'm just gonna look at the color of your shoulders. Do you mind if I just?
No.
Okay. Good, there's no normal color and no deformities or masses, and it doesn't feel like there's any swelling. So that's good. And the temperature feels normal, body temperature. I'm going to test your muscle strength by having you push up on my hands as hard as you can go. Good, thank you. Alright. Okay, so now I'm going to test your elbows and make sure they're symmetrical. And they look symmetrical, and the size is good, even on both sides. The contour is good, there's no bumps or lumps or anything like that, except this bruise. Where did you get that?
I play ultimate frisbee, and the frisbee can be really hard.
Oh, okay. Yeah, now I'm going to test your range of motion, and I'm going to have you flex and extend. Flex and extend. And does that hurt at all?
No.
Okay. Now I'm just going to quickly look at the skin and make sure it's even over the joints and there's no deformities or anything like that. The color's good, not red or swollen, so that's good. Now I'm going to test your muscle, and I'm just going to actually make sure that the temperature is it's not warm or anything. So that's good. And now I'm going to test your muscle strength.
Alright.
So I'm going to have you push down on my hands as hard as you can, okay? And then push against me, okay? And the other way. Okay, wow, you're strong.
Yeah.
Alright, now we're going to test your hands and make sure that these are symmetrical and that there's no swelling. The size is normal, which is good. There's no lumps, bumps, or masses anywhere there. Contour is good. No swelling, redness, or masses or deformities. And I'm going to have test the range of motion. So I'm going to have you turn your hands in, and that's inversion, and then out is exversion. And then I'm going to have you just kind of move up and down your wrists all around, move your fingers apart. And this is pronation and supination. Okay, good. When I test your hands, I need to feel just the fingers to make sure that there's no odd bumps, because that is an indication of osteoarthritis. So I'm going to make sure that that's good. And the temperature feels good. It's a little cold, but nothing to worry about. And strength, just push down on my hands and then push up on my hands. Good. Alright, now I'm going to test the range of motion in your hips. So I'm going to have you lift up your knee all the way as far as you can go. Good. And then I'm going to have you, actually bend your knee again, I'm sorry. Go out as far as you can go. Good. And in as far as you can go. Good. And then put your legs straight up as far back as you can go. Good. Okay, now I'm going to do the other one. So I'm going to have you bend your leg up to your chest as far as it can go. Out to the side as far as it can go. That's as far. Okay. And then over this side and up, straight up as far as you can go. Try and keep your knee straight. So perfect. Thank you. Okay. And I'm just going to make sure that everything's symmetrical. Good. There's no swelling or bumps or bruises or anything like that. Temperature is good. Symmetry is good. And that looks good. Now I'm going to test your knees. So I'm going to look at them to make sure that they are symmetrical. So that looks good. And there's no bumps or bruises. The size is good. There's no swelling or redness, which is good. No deformities.